Hi, my name is Sasha Zolik. I am the mom to 4 children. Currently live in Teton Village, Wyoming, although we have sought medical care throughout the country. I am here to talk to you about transitioning from pediatrics to adult care, and let's get right into it. I'd say my first piece of advice is to get ready for a wild ride. There's no clear path. Every doctor is different. Every doctor has different age cutoffs, and they're not even really supervised by the hospital policy as a whole. It really varies by specialty and by physician. Before you leave your pediatric care specialist, do your research. And my favorite resource are the nurses. So when I'm calling up to talk about a new adult care physician, I ask to speak to the nurses, and I like to leave a long-winded message about how we're transitioning and we've been referred and what do they think. Please call me back, and I leave my number. And we've gotten great data that way. I also think it's really important to practice with your child, calling and making appointments, um, emails. It's usually all done through MyChart or Helo or whatever online platform the health provider provides now. And then also, this is a big one, filling out and submitting reimbursement forms. And I find this especially helpful when it comes to the mental health side. My daughter, sees a psychiatrist and she sees a psychologist, and I don't need to know how many times a week she's talking with somebody. I just want her to know how to get the money back. When we arrive at every new appointment, we had printed off some business cards. We just got the cardstock from Staples, and it has my information on it, my email, my date of birth, states that I'm the mother, and it requests that I get access to her online chart and her medical file, and then she signs the back of it. Sometimes they have us sign a different form, but this usually gets the process started. And then the last piece of advice for, I'd say, your regular checkups is to create a post-appointment summary sheet. And this is to facilitate communication. The doctors don't see it. It's something that my daughter and I probably don't even really share as much anymore now that she's 20. But it really allows her to think back on what was discussed, what's the go forward plan, what were the changes being made, and when are we going to follow up again? And that just allows us to put it into the calendar. She shares her calendar with me so I can see what's going on. Some handy tools, questions. I really like to make sure that she has a list of questions ready for every appointment. And she just uses her phone, the notes application within her iPhone, an expo marker. I have one in my purse all the time. I use it specifically when we're admitted into the hospital, but I have been known to whip it out in doctor's offices and just write things on the window to make sure that I know what we want to discuss before we leave the room. My daughter also has a list of medicines, the dosages, and the prescriber, as well as their contact information. This is really easy for her to just hand to the nurse when they have to go over medications. And it goes into her file so that very easy for her to say, look, I need you to talk to Dr. So-and-so. That information's in the file. I handed it to the nurse on our first appointment. And then my favorite question for any new doctor is, are you capable of saying, I don't know? Any doctor who is willing to say, I don't know, let's try this, let's see what happens, is somebody that I know is willing to work with us. And I really prefer that approach to the, I've been doing this for 20 years and I know best. And my little don't forget slide. I encourage my daughter to email her physicians after every visit, restating what she got from the appointment. And this is also in that summary sheet. I'm old. I really like to create a paper trail. I really like to encourage communication. I think it's important for her to recognize communication and what is good, effective communication. Um, and it ensures that I know what she is expecting. I don't know about your child, but initially, this transition to adult, she came out with really a lot of high expectations on how her control over her care was going to change. And again, the details about when the follow-up is going to be and what they're going to be looking at in that follow-up. And the summary also allows her to relay positives and negatives with a little bit of hindsight. I think all doctor's visits tend to cover a lot of information, and we want to be able to look back at it and say, is that really what I wanted to do? Is that really my goal? Short term, long term, things like that. And some things that have worked for us. I'm a big fan of binders. In my binders are lists. It's a master list of her medications, her dosages, her prescribers. I have a list of providers and their contact information. Whenever I reach out to them, I refer to them as Team Zolik, and I want them talking to one another as much as possible. We have a master list of supplies that she needs, and so that we can take inventory and know when we're running low. I have a list of pharmacies. She is away at college, and we have them here. And then the appointment summaries are in the binder. Of course, there's copies of the insurance cards, and then we utilize a shared electronic calendar. And I believe we're coming up to my last, which is the biggest positive of transition. Leaving what we know is always hard, but the number one benefit of transitioning to adult care is a switch in perspective. Your child goes from being the oldest in someone's care to being the youngest. And this garners a lot of sympathy that tends to disappear as they age out of a pediatric hospital. It's hard to compete with a sick baby in an ICU. And a lot of the nurses that get transferred from floor to floor have a lot of empathy for babies because they can't communicate the same way older kids do. When you are the youngest in an adult hospital, you get a lot of, oh, you're so young. How are you doing what you're doing? You should be really proud of yourself. There is a lot more cheerleading, and that is a huge win. Any cheerleading I can get for my daughter is something that I want to keep. So those are some of the key elements that I have found as we transition to adult care. I hope you find them helpful. Thank you for listening.